Hi, welcome back to Back in Action. This is part two of the series. As a reminder, this podcast is accompanied by a blog post. The blog post goes over the general ideas of what we're going to talk about in today's podcast. But I'm hoping in today's podcast we can dive a little bit deeper into these concepts presented in the blog post. So feel free to read through the blog post or even maybe have it open and follow along as we go through today. Take notes if you'd like. But as a reminder, lower back pain is one of the most common complaints worldwide. It affects millions of people. It's the most common cause of disability worldwide. And most of the time when people experience low back pain, it eventually goes away with some rest, some stretching. Maybe they use over-the-counter medications like Tylenol or ibuprofen. Maybe they ice, maybe they heat. And most of the time, 80-90% of the time, those lower back pains go away kind of on their own. But what if it doesn't? If your pain lingers, what if it worsens or starts to affect your everyday life and your hobbies and your joy? How do you know if it's time to seek medical attention? And what type of healthcare provider should I see? If you ever found yourself asking these questions, you're in the right place. By the end of this episode, I hope you'll have a clearer understanding of when you should seek medical help for lower back pain, what type of provider is best suited depending on the situation, and let's run through it. So let's start with when is lower back pain an emergency? We'll start with the red flags, is what I call them, or the situations where you shouldn't wait to see a doctor, but you should seek immediate emergency care. If you or somebody you know experiences the following symptoms, you should probably call 911 or head to the emergency room. And that's back pain, accompanied by major trauma. That's like a car accident or a bad fall, or you were lifting something heavy and, it severely hurt your back. That kind of trauma can lead to fracture, significant spinal injuries, bleeding. And those things may require immediate medical attention. So if you're experiencing those symptoms following immediate trauma, it's time for emergency care. Another red flag is if you have a loss of bowel or bladder control, like suddenly experience incontinence or difficulty urinating along with your lower back pain, that'd be a time to seek emergency care. The last situation where it may be warranted to seek emergency care is if that back pain is accompanied by a fever. So if you're experiencing lower back pain and it's accompanied by like a severe fever, you take your temperature and you're well above that 100 degree mark, that would be a time where you would seek immediate emergency care. These are the kind of symptoms you don't want to wait and see if they improve. You should seek medical attention right away. Now, most lower back pain cases aren't going to require immediate emergency care. Most, again, like I said, are going to not require medical care at all. But there are some times where it's probably recommended that you should seek a physician, even if it's not emergent. So the situations where it's not an immediate emergency, but they still warrant a visit to a healthcare professional, is if your lower back pain lasts for more than a few weeks. It's not improving with home treatments like rest, stretching, or over-the-counter medications like Tylenol and ibuprofen. If those things aren't helping, it's been weeks and you're still experiencing that discomfort, it'd be a good idea to go seek a medical intervention. If that pain after a few weeks interferes with your daily activity, you're having trouble doing your job, you're having trouble standing, sitting, walking, or sleeping due to the pain, that'd be a good time to seek some help. Another one is if the pain radiates down your legs or both legs, especially if it goes past the knee. If you have burning, tingling, numbness, those are symptoms should be seen by a medical care provider. And lastly is if you have unexplained weight loss, again, a fever or pain that gets significantly worse at night, those symptoms combined with your lower back pain could signify there's an underlying condition, and that would be a good time to seek a medical care provider. If you fall into those categories, don't just tough it out. Make an appointment with a healthcare provider if you can and go get it checked out. But one of the most common questions I get is, well, there's so many different kinds of healthcare providers. Who should I go see? So let's say you've decided you should go seek a professional. Who do you go to? It really depends on your symptoms and the severity of those symptoms. So let's kind of talk through that a bit. The first would be a primary care physician, or a PCP. If your pain is mild to moderate, it's been going on for a few weeks, your primary care doctor is likely the physician that knows you the best. That's often a good first step. They can assess the condition, provide basic treatment recommendations, and if necessary, refer to you to a specialist, or refer you to another physician who can get you the best help possible. Another type of healthcare provider that is commonly used in the case of lower back pain is a physical therapist. So if it's that lower back pain is related to muscle strain or a postural issue or general movement issue, a physical therapist can be very helpful in those situations. They use targeted specific exercises, manual therapy like massage, and movement retraining, maybe some stretching, and those can help improve mobility and reduce pain over time. One that I get asked the most about is a chiropractor. A chiropractor specializes in spinal adjustments and manual therapy techniques that are used to reduce musculoskeletal pain. So if your back pain is caused by joint dysfunction or mild disc issue, chiropractic care may be beneficial, but you should talk to your primary care provider about that as well. If you have a structural issue like a herniated disc or spinal stenosis, or like narrowing of the arteries that lead to the spine, or fractures, you may need to see an orthopedic spine specialist or a neurosurgeon. These specialists can evaluate whether surgery or advanced treatment is necessary. Surgery should ultimately be a last resort, but in some cases it is the best option. It is necessary to go see those high-level specialists. In the case of chronic back pain that's not responding to treatment, there are pain specialists that are just for pain management, called pain management specialists. They may be able to help with that. They provide treatments specifically to reduce discomfort, like steroid injection, nerve blocks, all of the stuff that they do. Those can help you manage pain. And then lastly is a rheumatologist. If you're experiencing an autoimmune condition, like rheumatoid arthritis causing your lower back pain, they can help diagnose and manage that underlying condition that's leading to the lower back pain. So those are the different kinds of specialists that are generally seen for lower back pain. Again, a lot of times the best place to start is with your primary care provider, see what their thoughts are, and see if they have a specific recommendation for what type of provider to see and when to go see them. So kind of in conclusion is that I understand back pain is frustrating. Most cases resolve on their own, but some require medical attention. The key takeaway is that if your back pain doesn't improve in a few weeks, you should seek medical care. If you experience those red flag symptoms we talked about, like trauma, lack of bladder control, or fever, that might be a good time to seek immediate emergency care. And you may want to choose the right healthcare provider based on severity and cause of your symptoms. Maybe a few of those providers may work together to manage your discomforts. You may be seeing a physical therapist to learn some exercises and build some strength and learn some stretching for pain management while working with your pain management specialist to make sure that your day-to-day life can continue. Taking action can prevent long-term complications and get you back to living your life without pain. So it can often be best to not ignore these discomforts for a significant amount of time. I hope you enjoyed this episode. I hope you feel like you learned something valuable. Again, this is accompanied by a blog post, so feel free to read through the blog post. Reach out to me if you have any questions about this discussion. And we'll be back next week. And next week, we're going to talk about some more management type things for lower back pain. Maybe I'll have a few videos, some exercises, some stretching demonstrations. Now that we've gone through the basics of, what is lower back pain in part 1, and now, when is it necessary to see medical care? Now we get into the fun. Let's start stretching. Let's start some exercises. Let's start some preventative stuff. So next week I'll come back with some videos and some options for you for self-care management at home. And I hope you enjoy that. I hope you use that and find some benefit in it. So thanks for listening.